I can have everyone's attention, please. Thank you. Was that loud enough, Lee? Okay. So we just have a short program this evening, and then we'll continue mingling. I'm Dr. Susan Bissett. I'm president of the West Virginia Drug Intervention Institute, and I'm also a board member for the West Virginia Rural Health Association, and probably an honorary staff member of CEG as well. So I'm very happy to be here. This is the second year that our three organizations have done this together. And we like to do this as a celebration of some of the solutions in relationship to the syndemic here in West Virginia, and our organizations are doing some work beyond the borders as well. So I've been asked to welcome you. So welcome, we're glad you're here. Thank you for taking time out of your evening to join us. And I've also been charged with just sharing a little bit about the Institute. So the West Virginia Drug Intervention Institute is relatively new. We've been around for about 4 years. We started in 2019 thanks to a gift from a donor-advised fund from Truist. And we have just taken off like wildfire in those past 4 years. Our mission is to reduce overdose deaths in West Virginia, Appalachia, and the nation. We have three really key programs that we're razor focused on. One of those is our Don't Keep Recs Around Medication Safety program. If you are familiar with WOWK or WSAZ, you've probably seen the cartoon of Rex talking to Grandma Peg about making sure that she stores her medication properly and disposes of it properly. Grandma Peg is modeled after my mother, who is Grandma Peg. So when you see it next time, you'll think of my mom. The second program is a co-dispensing program where we have partnered with pharmacies across the state of West Virginia to counsel patients at time of opioid fill. The pharmacist does an opioid screening tool with that patient and then determines whether or not they should receive naloxone and take it home. And they also receive a medication disposal kit, and we just received a no-cost extension grant for that program. The third thing is something that we're particularly proud of, and that's our partnership with the One Box, which is the emergency opioid response kit with our friend Jan Rader inside the box. So it's designed to do three things. One, put naloxone in proximity where overdose is likely to occur. One, provide step-by-step instructions on how to respond to that emergency, including not only administering the naloxone, but also turning the person into the recovery position, talking to EMS when they get there. And then there's a longer training form in here so that you can train every person in your organization according to our state standing order on how to utilize naloxone. Couple of good pieces of news about this. It's in 30 states across the nation. And so we're very excited. We did this when Joe Murphy from Huntington, West Virginia invented this box. He did it to respond to West Virginia. People are watching to us for the solution to this epidemic. We are no longer at the bottom of the list, we're at the top of the solutions list, and that's where we need to be. A couple other pieces of good news about this: it'll be in every public library in West Virginia, thanks to state opioid response monies. And in the next couple of weeks, we are also going to be making an announcement about a very generous corporate funder who is allowing us to provide boxes to every high school and middle school in West Virginia. So we're very excited about the ability to get these out where they need to be, where overdoses are likely to occur. The box is purple by design because purple is the color of recovery. I call this the Tiffany box of emergency response, right? And people laugh at me, but Lee knows I actually have 3 empty Tiffany boxes sitting on my desk. So it's meant to destigmatize it. It's meant to look pretty. It's meant not to scare people. And so that's what we need to do. So we do have them with us. I'm not going to spend some time opening the box, but Lilith behind me is on our staff. She's our outreach coordinator. Ed Sisson, our fundraiser, is at the back of the room as well. And so we'll be happy to talk to people when we mingle. I have been overwhelmed by the support of A. Tony Young and Lee Storo and Rich Sutton. And Tony knows this. Rich, Lee, and I call ourselves the 3 Musketeers. And anytime I'm having a bad day, those are the 2 gentlemen I text, and I always get back exactly what I need. So they are doing good work here in West Virginia and beyond, and I'm just so honored to be here and collaborate with all of these fine folks. So with that, I'm going to turn it over to Taylor Orn, who is here with Tyler. I was so focused on your last name that I messed up your first name. Tyler Orn from Carol Miller's office in Washington, D.C.
Well, thank you so much, and the Congresswoman really regrets she couldn't be here today. I know she appreciates all the hard work that you all do in trying to make our community a better place, and unfortunately she is in D.C. this week on congressional business, but she did ask me to come here and read off this greeting on her behalf. And it says, "Dear friends, I was honored by your invitation to attend Celebrating Solutions, Strategies for the Future, a community leader and legislative reception here in Charleston. I regret I'm unable to be with you today, but I send my best wishes for a successful event. It is truly inspiring to see so many individuals who are dedicated to public health policy coming together this evening. Each and every one of you play a crucial role in increasing the well-being of our population, promoting healthy behaviors, and preventing the spread of infectious diseases. I'd like to thank the West Virginia Rural Health Association, Community Education Group, and the West Virginia Drug Intervention Institute for organizing this reception and their continued leadership in combating several public health issues facing our state. While there is not one single solution to solving our healthcare crisis, I am confident that the individuals in this room will continue to be helpful in assisting our state and region in dealing with our public health matters. To all here today, please know that I will continue to fight for West Virginians on the federal level, and I'm honored to be your voice in Washington. Sincerely, Carol Miller, Member of Congress."
I think it's me. Oh, Rich? You sure? Yeah. Rich, if you want to be the closer, I mean, I can. I can do it. First of all, I'd like to thank you. I'd like to thank Representative Miller for coming and giving that fine speech. Some of you may or may not know, but we've heard through the grapevine that you'll be opening up an office on the west side. Is that not true?
Yeah, 3 Tennessee Avenue.
Okay, so we've got members that are now coming into community. That's one of the things we certainly want to see. I'm stuffed up, so I apologize. But I wanted to thank all of you for coming in. You know, one of the things that Susan said is that Lee and Susan and Rich are, in fact, the 3 Musketeers. You know, there are other folks in this room that certainly are doing work in West Virginia and doing work in the Appalachia region, but the 3 of them have kind of formed this bond that I think is, sorry, Reverend Patterson, somewhat unholy. You know, I mean, because, you know, so often in the work that we all do, you know, it's competitive. Who's going to get the money? Who's going to get the grant? Who's going to take the lead? Who's going to be in charge? And, you know, I think that when we started doing work in this region of the country, and we still are, the new kids on the block in a lot of ways. Susan talked about being the new kid on the block. You know, Rich is the oldest one of us all, so I really think that, okay, Rich, I'm kidding. I know, it's me. But, you know, but the truth is that really forming bonds with those folks, forming bonds with Reverend Patterson, forming bonds with Bishop Haley, Reverend Watt, with many of you in this room. You know, that is the way we believe that we get work done. I said it the last time we were in this room, and I'll continue to say it, is that our goal, one of our missions at Community Education Group, is to figure out ways in which we bring more resources to the region, not just for us, but for all of us. It's that we must bring attention to the region, we must bring attention to the need in the region, and in order to do that, we have to create some partnerships that weren't there yesterday to make sure that they're there tomorrow. But we've got to help people that don't necessarily look like us, sometimes don't think like us. That's not the point. Our point is to be able to build the bridge to success for those individuals. So I want to take a minute to introduce a couple of folks. Lee Starrow, our Senior Director of External Affairs, who has been just really crushing it. Brandon Morales, who is our Communications Mastermind. We've got Jason Lucas, who is running our CHAMPS training program. And I give him a double round of applause because he pulled that thing out of the fire. Out at the table, we have Ashley Cooper, Caroline Schuster. Somewhere else we have, who else? We've got, why did I just blank on your name? Okay, give me 5 seconds. It's not gonna come. Help me.
Trey.
Trey! We got Trey, and we got Haley, and we've got, is that it? Did I miss anybody else?
We were having a conversation about engagement,
Uh-huh.
and we got distracted.
Okay, so you are now going to just be the external affairs director. Senior's gone, no more. But I also wanted to introduce some of the folks that are not from West Virginia that are here. You want to say who you are and what you do?
So Beth O'Connor, I'm the Executive Director of the Virginia Rural Health Association, therefore the counterpart of Rich.
Right, there you go. So, and I think we have Marilyn in the house as well. Where's Melissa? Melissa, where's?
Right over here.
All right.
So I'm Melissa Clark. I'm the Associate Director at AHEC West, but I actually live in Mineral County, West Virginia. We serve the 3 Western Maryland counties in Maryland, as well as spill over into Pennsylvania and into West Virginia.
Thank you. So, over the last year, like I said, CEG's done a lot of work. They hate me every day because I come up with something new for us to do. And they're like, okay, we don't have enough people to do all of that. Stop nodding. But, we've just bought 3 buildings on Central Avenue, which I actually blanked on earlier today. But we also bought a building at 634 Grant Street, and then we bought a building at 200 Elm Street. And so our goal, our mission is to now build a basketball court and a playground at 634 Grant Street and try to put some lockers in there for FedEx, UPS, and others. So we're gonna kind of do 2 things. So kind of add the playground piece, but also, kind of support other community members to address porch pirates in the neighborhood, but also have some community meeting space. Then what we want to do is create with partners like Reverend Haley, Reverend Watt, and Reverend Patterson, try to create a workforce development corridor around Central Avenue. Because, people say, oh, well, why would you buy there, or why would you put it there? The crime rate's so high. Well, if we don't put something there, it's going to stay high. And so we want to do that. But the other thing that we want to do is make sure that we're investing in West Virginia, investing in Charleston, figuring out how we stop the sucking out of people from Charleston. If we don't have people here under the age of 40, what are we going to do? We got a problem. We need to address it. So no, I'm not going to run from here, but I thought about it. You thought it coming, didn't you? But a little bit you thought you heard it, right? But all jokes aside, we've been doing another program with our home test kits. And for those of you who may need a couple of home test kits, we have some out on the table. If you're there, we've been doing that with CDC Foundation, with over 50 organizations across the United States. And what I would just like to say is thank you all for coming. Thank you for all. If you're in this room, that means you're a friend of ours, not just a partner of ours. And so I just want to thank you for all of that. We've got some more big things. As we like to say, we're going to be doing great things here at CEG, and we're going to continue to do that. Rich, you want to close us out? Sure. And maybe just bring pictures of the baby.
She jokes, but the baby is the best part. If you take a baby in the Capitol, everyone will talk to you. Everyone loves a baby. So I'm Rich Sutphin. I'm the Executive Director of the West Virginia Rural Health Association. Thanks to Susan and Lee and Tony for including us in this planning of this event and participation. One of the programs that West Virginia Rural Health Association is really proud of is the West Virginia Academic Mentoring Partnership. Through that program, we now have 2 separate programs to train primary care providers to treat 2 parts of the syndemic that we're all concerned about, hepatitis and HIV. So yesterday was our first HIV training. It's a half-day training. We had 25 people who are primary care providers, mostly in rural areas, coming to us saying, hey, we need to know how to treat HIV. We're seeing it more and more. How do we screen? How do we prevent? How do we diagnose and treat? And so that's what we did. We put the program together, the same model as our HAMP model. Now the HAMP model is really cool. Over the past 3 years, it started in March of 2020 with one in-person event, and then went to a fully virtual format, and has stayed that way. But we've trained over 100 providers who are doing consults of patients who don't have access to infectious disease. So what have we done with that program? We've treated over 900, we're getting close to 1,000, 900 individuals in the state have gone through the process of being treated. We have cured over 98% of the people who have reached the 12-week mark. So the program works. The literature say that, infectious disease faculty can cure hepatitis C in about 95% of the time. We're at 98%. So we're showing that if you empower your rural health workforce to treat complex diseases, you're better off. So we estimate that there's about 20,000 people in West Virginia with chronic hepatitis C. So we're 1/20th of the way of curing hepatitis C and eliminating it in our states. So again, thank you all for being here. And I think now it's time to mingle.